Imagine waking up one day feeling on top of the world, only to crash into a deep depression the next. Now picture experiencing intense mood swings multiple times a day, coupled with a crippling fear of abandonment. Which scenario describes bipolar disorder and which points to borderline personality disorder? The answer might surprise you. Bipolar disorder and borderline personality disorder are often confused, even by some healthcare professionals, but understanding the difference is crucial for proper diagnosis and treatment. So let's dive into the world of these two complex mental health conditions and unravel their mysteries. Let's start with bipolar disorder. It's like being on an emotional roller coaster that takes you from extreme highs to devastating lows. During manic episodes, people with bipolar disorder may feel invincible, bursting with energy and grand ideas. They might go on shopping sprees, make risky decisions, or stay awake for days. Then comes the crash. Depressive episodes that can leave them unable to get out of bed, feeling hopeless and sometimes suicidal. The key here is the duration of these mood episodes. In bipolar disorder, manic or depressive states typically last for days, weeks, or even months. It's not a rapid shift, but more like extended periods of extreme moods with relatively stable periods in between. Now, let's shift gears to borderline personality disorder, or BPD. If bipolar disorder is a roller coaster, BPD is more like a chaotic carnival ride. People with BPD experience intense, rapidly shifting emotions that can change multiple times within a day or even an hour. They might go from feeling okay to angry, then sad, then anxious, all in the span of a few hours. One of the hallmarks of BPD is an intense fear of abandonment. This fear can lead to unstable relationships, with cycles of idealization and devaluation. One moment, a person might be put on a pedestal, the next, they're seen as worthless. This instability extends to self-image too. People with BPD often struggle with a sense of who they are, leading to frequent changes in goals, values, and even sexual identity. So how do we tell these disorders apart? Let's break it down. First, look at the pattern of mood changes. Bipolar disorder involves distinct episodes of mania or depression lasting days or weeks. BPD, on the other hand, features rapid mood shifts within a day, often triggered by interpersonal events. Second, consider the nature of the mood changes. In bipolar disorder, manic episodes often involve decreased need for sleep, increased goal-directed activity, and sometimes psychosis. These aren't typically seen in BPD. Instead, BPD mood swings are more reactive to environmental factors, especially in relationships. Third, examine the stability of relationships and self-image. People with bipolar disorder generally maintain a consistent sense of self and stable relationships when not in an episode. Those with BPD struggle with chronic instability in these areas. It's also worth noting that while both conditions can involve impulsive behavior, the motivations differ. In bipolar disorder, impulsivity is often tied to manic episodes and the pursuit of pleasure or goals. In BPD, impulsive actions are frequently attempts to cope with emotional pain or fear of abandonment. Treatment approaches for these disorders also differ. Bipolar disorder is primarily treated with mood stabilizers and sometimes antipsychotic medications. Psychotherapy is helpful, but usually secondary to medication. For BPD, the opposite is true. The gold standard treatment is psychotherapy, particularly dialectical behavior therapy, DBT, with medications playing a supportive role in managing specific symptoms. It's crucial to remember that these disorders can co-occur, and some people may have symptoms of both. This is why professional diagnosis is so important. If you or someone you know is struggling with mood instability or relationship difficulties, don't hesitate to seek help from a mental health professional. Understanding the differences between bipolar disorder and borderline personality disorder isn't just academic. It's the key to getting the right help and support. By recognizing the unique patterns and challenges of each condition, we can better support those affected and work towards more effective treatments and management strategies. Remember, mental health is just as important as physical health. Whether it's bipolar disorder, borderline personality disorder, or any other mental health condition, there's no shame in seeking help. With the right diagnosis and treatment, people with these disorders can lead fulfilling, balanced lives. Let's continue to educate ourselves and others, breaking down stigma one conversation at a time.